This BMore Lifestyle segment is sponsored by MVS Woundcare and Hyperbarics.
Welcome to the MVS Woundcare and Hyperbarics Center. Today we're visiting with Dr. Richard Franklin. He is going to tell us all about this amazing space that we are standing in. Dr. Franklin, thank you so much for being here with us today. So first, tell us a little bit about yourself and MVS Woundcare and Hyperbarics.
MVS Woundcare and Hyperbarics is a center where we provide advanced wound care for chronic ulcers and wounds that don't heal, in addition to having hyperbaric therapy as an adjunct or an additional therapy, in where we can use oxygen as a drug to help heal wounds that are a little bit more stubborn.
Okay, so what really sets MVS apart and makes you guys unique?
We're a freestanding center. We're not associated with any hospital. We have several centers around the Beltway so that we can service the entire Baltimore area. We have 3 different centers with hyperbaric chambers, giving us a total of 10 of those. It's a multidisciplinary team, so we can interact with each other, including surgeons, plastic surgeons, vascular surgeons, podiatrists, and we have several Baltimore's best doctors as by Baltimore Magazine.
Okay, all right. So talk to us about a wound. What makes it a wound, and then what kind of conditions do you treat?
Wounds and ulcers, we use the terms interchangeably. Wounds generally in medical literature would be something traumatic or acute, whereas an ulcer is something that is chronic and has not healed as we would expect it to.
And so what are the causes of some of these wounds?
We treat a lot of diabetic foot wounds, radiation wounds, acute burns, something that wouldn't necessarily go to the burn center, for example. Venous leg ulcers, arterial ulcers, pressure wounds, surgical wounds that have broken apart, which happens occasionally, but almost anything that has been slow and chronically present and difficult to heal.
So how does a patient know that they need hyperbaric oxygen therapy?
If something doesn't seem to be going along the way it should be and healing in a relatively normal period of time, being anywhere between 2 and 4 weeks, they ought to come and see us or give us a call and let us at least evaluate it. The worst thing we're ever going to say is, you're going to be fine, there's nothing we can do.
And what other conditions besides wounds does the therapy here treat?
So aside from wounds, we also treat radiation injury. For example, men who have had prostate cancer treated with radiation therapy will occasionally develop radiation cystitis or a radiation injury to their bladder, and we can make that better.
All right, and tell our viewers where they can find you.
We're on the web, mvswoundcare.com. You can call at 410-433-4300.
All right, Dr. Franklin, thank you so much for the work that you're doing. Thank you for joining us today, and thank you for sticking with us too. We'll be right back.